Okay, sir, I have following situations. So how do you respond, or ideally, how should we respond to such situation? First situation, for anybody, any patient who asks you discount.
My clinic fundamental says we don't give discount to any patients. Out of regard, I may reduce anything out of my personal wish or will, but otherwise, if somebody asks for discount, we say we are fixed. And for that, I always prior inform the patient about the charges. Yes, and I always would like to make sure that my estimates are correct. If it is a deep filling, I would, and I'm planning to do a IPC or a sandwich technique, I will convey the patient both the charges. Not that nahi ye filling ke alag the, base ke alag the, IPC ke alag the. We won't do that sometimes. To convey the full charges. Sometimes in the fear of losing the patients, we don't do that and then create a problem. But yes, the discount thing comes only into picture if we are not conveying it beforehand. My clinic policy says no discounts for anyone except to whom I want to or whom I desire to give.
Okay, the patient who bargains.
The patients will never bargain because I mentioned that my things are conveyed beforehand. Then we have a written consent system in which the costing is mentioned. It is signed by 4 people, 2 witnesses and the patient and the doctor. So we need to understand, the patient knows that I have agreed upon the same thing. The ICF or the informed consent means one thing, which the law also says, both of us, patient and the doctor, agreed upon the same thing in the same sense. So that would mean that I have, say, agreed to treat you for this treatment for this amount. You have agreed to got this treatment done from me at this amount. So where does the question of bargaining come? Still, we can face 5 to 10% of bargaining people who will try out of their Indian mentality to actually push in something. Maybe if it works, but if you are stern on something, the patient day before yesterday, I told you an example who told me you are very costly. He tried his level bit. To dekho kal Father's Day, I am like your father, do it. If you are like my father, you will never want your son to go into a negative mode or his earnings going into red. So you understand that you should be actually more willing to care about your son's future. So don't pay me less, rather pay me more. So the patient had no answer. So he ultimately paid me the amount that I wanted. But yes, before going, he said, you are very costly, although you have a good service. I told him, thank you, sir. I take that as a compliment. He just laughed it off. So that is the thing.
Very nice. How do you respond to anybody, either it be a patient or a doctor who badmouths other doctor?
See, when these things happen in clinic, that is the reason I say, don't be so bogged down in your work here. You're not alert and awake in your surroundings. The patient comes, like the Chandigarh Ambala example I gave you for the 56,000 case in the beginning. The patient comes, you're too busy, you don't even bother to take the consent, you won't even bother to ask the patient what is he in air for. We don't do such thing. We ask the patients, what is the problem? I had this treatment, this thing was destroyed by another thing. Said, what do you want now? Yeah, some patients are very vocal. They say, I want you check it out and write me that this thing has been committed wrongly. I politely say, sorry, sir, you are in wrong place. That is the door. I don't write in written against my colleagues. Said, Doctor, jo hua, mere is daan ko theek karke do mujhe bas. So I have been referred to you by someone. I want you. So my first thing to them is, yes, I agree to treat you. The formalities, yes, we'll do it. The consent part and all those things, we'll do it. But we shall not discuss the past. You will not discuss. And many times I've treated such cases where I even don't know the name of the treating doctor. And sometimes the patients have told me, जाते जाते आपने पूछा नहीं पर मैं बता देता हूँ वो आपका वो फलाना दोस्त था. Sometimes people know it's your friends on Facebook and all those things. They can make it out. आपका वो Facebook वाला friend था वो. You come to know about it. But then I'm not interested in knowing that because that is not important to me. What is important to me is that I treat the patient and correct the patient, and I'm not interested in writing against a colleague. The again reason, dentist का सबसे बड़ा सगा है.
Yes. How do you deal with window shoppers? I know, I mean, we dentists, we complain more of, window shoppers. भाव खाली बता दो, फिर हम decide करेंगे.
I always say them, maybe my assistant says them in the waiting that the doctor will check only because certain things can vary. They are not very complex in making them understand this thing. if I am free, if I don't have any patient in the OPD and such a patient turns up, I talk myself to the patient. I don't let the assistant talk. But if I am busy working, the assistant talks. So जैसे डॉक्टर साहब देख के बताएंगे एक फिलिंग 800 में भी हो सकती है, 2000 में भी हो सकती है. That is the way he says it. So he actually tries to generalize the thing. The patient says, I want to ask the rate. I said, you'll have to pay the consultant fee from me, get the checkup done thoroughly, and then you can get the every kind of quote from me. The patient says, sorry, I am not ready to pay the fee. He says, sorry, we are not tell the rates also. It is a personal choice how you deal with such a situation. Yes, politeness and courtesy is one thing. We don't cross that limit. But if the patient says after paying the consultation fee, wants to ask the pricing of all the treatments other than the one he showed for example, he showed us for a cavity, maybe for a root canal, maybe for a crown. He wants to ask for surgical part and extraction, third molar, and all those things. We even divulge that once he has paid the fees. So it is for them to make a judgment whether we are going to do into that or not. At this point of time, because of my background in writing that book also and my clinical experience also, I try actually to make sure that the patient's consultation is attended to in a good manner. And I always believe कोई भी नई consultation जो आती है वो मेरी third consultation. The first consultation is the patient's original doctor. The second consultation is patient's universal doctor, Dr. Google, and I am the third consultation. So I want to be the patient's first consultation, and the only way is by my communication, by my consultation, so that the patient is impressed by that. And it need not be mean that I am singing the tunes of my before and after my work done. It is the way to talk. It is the way to understand, comprehend, and express the solution to the patient's problem. And that starts first with effective listening. Once you listen to the patient's chief complaint, they will tell you many things. And once you listen to that, give out your solutions in short, the patients will understand, nahi, ye doctor acha hai, ye doctor siyana hai. That is the one realization they have. And once they have that, turning them into your loyal patient is just a mere formality sometimes.
Okay, and if I were to ask you, what is your criteria of giving a discount to any patient?
So the only thing is that I give discount only to relatives, families, or friends. So, or known people, or maybe medical colleagues. So my criteria are minimum 10% or maximum 20%. Again, those things are made very clear, and I'm very transparent about that. I do not actually overprice or over raise the charges and then reduce it. Whatever my charges are, I genuinely give them discount. But I mentioned prior, for example, this treatment charges are 10,000 rupees. But as a general discount, as a known person, we are offering you 20%. So you will have to pay me 8,000. And we mention the same in the consent as well. And we do it very, very transparently. It does not कि वो पहले 12,000 बता के उनसे 10 ले लूं. That will not be happening in my clinic. But this is the way I work. But my minimum is 10%, maximum is 20%, only to known people, only to friends, family, medical colleagues, or maybe relatives. But any other loyal patient, I would always want to give them in kind. Okay, I'll do this procedure as an extra advantage for you. अब वो वैल्यू वो निकाले कि एक फिलिंग कर दी इन्होंने 1000 रुपए वाली या 1200 वाली या स्केलिंग कर दी 2000 वाली. It is their choice how they derive the inference from that. I don't tell them a monetary value कि मैं आपकी 2000 की स्केलिंग फ्री कर रहा हूँ. I don't do that sometimes. So I just tell them, okay, you are my loyal patient. I'll give you something in kind. I never reduce them in cash.